sinus are just air spaces within our skull to make our skull light. So first we have to clear the doubt that sinus is nothing alien thing which is coming and affecting us. It is very much within our system, affecting due to change in weather, might be due to viral etiology or some other conditions. Sinusitis is nothing very uncommon, it's been there for centuries, but we have developed some misconceptions about what is a sinusitis. If I am getting affected by sinusitis, am I going to die? Is my health going to deteriorate day by day? Or how bad it is really in the time run, how bad it is going to be? Is it curable? Do we need a surgery? So you often get flooded with patients who are in need for a good treatment plan, and just we can assure that sinusitis is very much treatable if it can be diagnosed in the proper time and in the proper manner. Now, sinusitis is something which can affect any age group, starting from a child up till the age an old person, middle-aged, male, female, everybody can be affected by this condition of sinusitis. They usually tend to present to us with a headache, which can be in the front of the head, which can affect the whole of the head, which can have a heaviness feeling, a reeling feeling of the head, and even with some associated symptoms like a nasal congestion, a nasal blockage, a puffiness of the face, a redness of the cheeks, and sometimes an acute pain can be associated, which is more likely in case of children. Depending on the duration and the nature of the headache, we can really make out which sinus is affected. What happens? These sinuses get aerated through our nose. So whenever or whatever conditions is leading to a nasal blockage can lead to a sinusitis, which can be acute, presenting with pain, or which can be chronic, presenting with persistent heaviness of the head, a feeling of unwellness, lethargy, waking up in the morning with a really weak feeling, not feeling up entirely to the mark, a lethargic all through the day. So this is chronic sinusitis. We have to first detect either it's an acute condition or a chronic condition. So whenever anybody is presenting with an acute pain in the head area or surrounding our eyes area or in the cheek areas, consult your nearest doctor, specifically an ENT person, to detect whether you are having a sinusitis or not. An ENT personnel, through clinical examination and through some diagnostic test, can actually detect which sinus is affected and at all the person is suffering from sinusitis or not. Now, sometimes we tend to ignore a long time nasal blockage and we keep on pouring in bottles of nasal drops which are readily available in the market to remove our nasal congestion. This is a vicious cycle which is again not only leading the patient to a chronic condition of sinusitis, but is also making the treatment part more challenging. So first, come to a ENT doctor. We will detect whether you are suffering from a sinusitis and what is the exact etiology behind your sinusitis. At Medica, we are there with all the modern techniques to detect whether you are affected with a sinus condition or not. We are readily available with our nasal diagnostic endoscopes, scanning procedures, and even a thorough checkup clinically so that we can detect your sinus conditions. And if you are suffering from chronic sinusitis due to some nasal etiology, nasal pathologies, we are there to remove the pathology and to definitely give you a better life free of this headache and heaviness of the head. We are performing here all the modern endoscopic sinus surgeries with the latest instruments like microdebrider and even the coagulators to give you a disease-free life with the shortest duration possible stay in the hospital. Even our sinus patients who are in need for a surgery, they can go back the same day of surgery with a smiling face and coming back to us to say that they are free of their headache and heaviness and they are really having a different life, a good life now. But always surgery is not the lead, that is entirely dependent on the symptoms of the patient. If the patient is having recurrent bouts of headache, please consult or come to us so that we can help you out of your condition. Also, one interesting fact that we are noticing here, being an academic institute of higher excellence, this Medica, we are keeping data of each and every patient, and post-COVID data is giving us an interesting fact that sinusitis is on the large of those patients who have been affected with COVID. Might be in the first wave, might be in the second wave. They are facing lot of issues with nasal blockage, and on subsequent scanning we are finding that a chronic sinus condition or even a nasal polyp is infected and is harvesting on the sinuses. Most of the cases requires a surgery which is absolutely painless, and as I said before, it's a day care procedure, so the patient can be released on the same day with minimal blood loss, with minimal morbidity on the part of the patient. So don't ignore if you are having or suffering from headache for a long time, whatever the age group you are belonging, come to us, we are there to help you. Thank you.